We often get patients coming into the clinic where they've cut out newspaper articles, or they've read something in a magazine and they ask, I've read about this treatment and I want this. But patients don't always understand that, particularly for these newer treatments, the immunotherapies, there are very specific criteria. We're not necessarily going to give this to somebody who's not yet had a TURBT, for example. Do you find that you get a lot of that, patients asking for treatments that they're not actually eligible for?
So I do, but I welcome that, because really it starts the conversation. They're looking at what's out there, and they're hoping there's something better, and so are we. So we're really aligned in that we're hoping that something better is out there. What we can do then, I usually say, bring it in. Print it out off the web, bring it in to me, and we'll talk about it. I'll let you know where it is in development, what it's for, why or why not I recommend it for you. Sometimes patients bring in exactly what I'm about to recommend next, and sometimes they bring in something that's only been tested in mice and we have to explain the process. But I really welcome the research that patients do. I think what our job and the job of the Advocacy Network is to guide them as to where to go. So Dr. Google is not a good idea. Typing bladder cancer into a Google search bar is not going to necessarily give you the best information up front, but bcan.org, nccn.org, National Comprehensive Cancer Network, nci.gov, which is the Government Cancer Research Network. All of those organizations really work to make patient-level education materials available, and I would say those are the places to start. Type those into your search bar and start from there, and then bring it to your doctor. I think bring it to us. We love to see it and to talk about it.
And it's not just about knowing what's available, but the Bladder Cancer Advocacy Network can certainly help patients get to a centre of excellence close to where they live, and to collaborate with clinicians. And I think it's fantastic to be able to offer patients the opportunity to talk to other patients. There's no better way to understand patient experiences than someone who's already been through it. And it was superb to hear that Michael had the opportunity, and I think it would be great if patients were able to ask if there are other patients that they can speak to if they're undergoing either surgery or chemotherapy or immunotherapy. Patients shouldn't be frightened to ask for these services, should they?
No. And I know, Jean Marie, you probably have a lot of patients that you can make a referral to, but imagine a patient that's not being seen at a large institution that would even have a lot of patients that have gone through various procedures. That's where we can come in, because we do have about 30 or 40 volunteers who've done all different types of procedures, and we try to match them on age and gender and other circumstances when we can, but it's an opportunity for them to sit down and talk to somebody who's gone through this before, who's walked through the fire and come out the other side successfully, and it's just nice to know you're not alone.
What are the main reasons that people come to the network for advice? Is it to look for the newer treatments? Is it to look for a centre of excellence? Is it to ask about clinical trials? What are the main drivers that bring patients to the network?
Yes, and to understand their disease. And we have a lot of resources. Not only do we have a new Bladder Cancer Basics, which is a comprehensive patient guide that's written in plain language to really understand with illustrations what the various diagnostic procedures are, what the different treatments are throughout, including immunotherapy. But also we have our website, which has quite a wealth of information on it. We also have a series of what we call the new normal videos that discuss patients' experience with the different types of diversions that they decided to have. Most people don't realize you can live without your bladder. It's different. Again, we call it the new normal, and you can survive very well without your bladder. But people have a hard time thinking about that. Of course, the best bladder you have is the one you came in with, but when that's no longer an option to keep, you need to come up with a better plan. So finding that right mix of which diversion would work for you. For instance, Michael mentioned that he was aiming for a neobladder, and a lot of younger patients want to have that so that you're still voiding through your urethra. It's still normal in that sense that it's still the way that you had done things. But there are people who do very well with many of the other different types of diversions. There's a few different types, and it really is up to that individual patient to decide which one is best for them. one of the things we offer is the opportunity to speak to a patient who's gone through, so they can share their experience.
Hugely valuable, yes.
And tips that they learned. And a lot of what we do is patient-driven. They give us the information. They say, I wish I had known this. And so we develop resources like our Get the Facts pages that are really intended to provide the questions that they wish they had asked to their doctor beforehand. And now that hindsight is 2020, we really do rely on our patient advocates to help contribute to those pieces that we do for sharing that information out with the general public.
There's a huge amount of psychological issues just coming to terms with a cancer diagnosis and not knowing whether their disease will be curable and what treatments are necessary. And obviously the side effects that go with many of these systemic treatments. But bladder cancer is one of those cancers where the surgery itself can bring out a lot of psychological issues with the stoma, the whole concept for many patients who do not have the option of reconstruction with the neobladder that you've already talked about. How do you help patients navigate the way through the psychological issues of having to deal with a bag, and particularly for older patients who may have heard about horror stories from 20, 30 years ago? How do we educate the caregiver who probably has questions and concerns about that as well?
Well, it helps to share the experience of patients who've managed it very successfully. I think that there's a lot that you can learn by hearing from other people, and we use and we rely on those patient advocates to help guide us in terms of sharing the kinds of information that we think are going to be really useful for people who are at that crossroads where they're making those decisions about the type of diversion or the type of treatment that they want to have. And so I think that being able to bring together that sense of community, that you're not alone, is one of the key things. We've had an online community on the Inspire network. It's our bladder cancer community, and it's probably got about 26,000 people. There are patients on there, there are caregivers, there are family members that are not directly involved in the day-to-day care, and it's amazing what happens on there. When we look at the conversations that are going on, that really helps drive a lot of what we do when we see that there are issues. There are issues with veterans, there are issues about what do you do when you have infections afterwards, or what do you do if you end up with a metastatic disease after you thought you'd gone through everything you needed to do. Your bladder was gone. How could it get any worse? And then suddenly you're faced with metastatic disease. And from that patient perspective, that's really important, but also from that caregiver perspective, we often refer to family members that are directly in care as being co-survivors, because they're co-passengers on this journey.
In terms of the patients with bladder cancer, obviously a huge spectrum. We're talking about young patients, old patients, male, female. Are there any patient groups in particular where you think they may have specific issues that need to be addressed? For example, I'm thinking about younger patients who may have gone through major surgery and have issues, questions with fertility or the sexuality side of the surgery. Any specific areas that are not well addressed by doctors?
You're right on all of those counts, in particular in the sexuality issue. People will say, well, my doctor took out my bladder and they saved my life, but then once you get used to the daily living that goes along with it, they're like, wait a minute, they didn't talk to me about the sexuality issues. Now, that's not that they didn't talk to them about it. It's the fact that they weren't listening. The patient wasn't ready to think about that. They were just thinking, I need to get this cancer out of my body. And maybe they didn't give it the attention that it needed in terms of choosing the kinds of things, or selecting a physician that might be more cognizant of the sexuality issues. And I think sometimes, even when you think about it, some patients might not even make assumptions about, or they might make assumptions about a patient that might be older, thinking, well, I don't need to have a big discussion about sexuality because they're 70 or whatever. And they don't even bring it up, or they barely cover it, and they don't really wait for any kind of questions that the patient might have. Maybe the nurse gets the questions, but that's a big issue. And when you're talking about bladder removal, for men, they remove the prostate and the seminal vesicles, and there are obviously nerves in that area. For women, depending on where the bladder cancer is actually located, they may have their uterus removed, they may have their vagina may become shorter. That can lead to significant problems with intercourse. But there are other ways to learn to be intimate. And again, we do bring in those experts, and we have webinars on our website, we have fact sheets on our website that are specifically addressing those quality of life issues, because ultimately we'd like to live better after bladder cancer once you've had treatment and you feel good that you're safe from a recurrence, but you still have to address those quality of life issues.
And how do you promote awareness of the network? You obviously have a website.
We do have a website, www.bcan.org, and we have a clinical trials dashboard on that website where people can search for bladder cancer specific clinical trials by the disease state, whether it's non-muscle invasive or metastatic disease. They can search by their geographic state. So let's think that perhaps somebody lives in the New Jersey area. Maybe they would be willing to travel to New York or Pennsylvania or Delaware for a trial. They could click all of those states and find out what trials are being done for them in those particular areas. And you can even save a trial to come back to later, or say adult children could look for their parents and send an email with the trial to their parents or to their doctors. Patients can send directly to their doctors saying, do you think I should look into being part of this trial?
And for patients who may not have access to the internet, you have a telephone support line for patients to reach out to?
We do. And our direct line is 301-215-9099. And what's really, I think, unique is that we actually have patients that will return calls. When patients want to know how to navigate, how to find the right information, we do have things we can send out to them, but it helps to have another patient walking them through that journey so we can see what exactly they need. So we have a volunteer group that actually help us answering some of those calls.
And just a final comment, as a urology surgeon taking care of bladder cancer patients for the last 25 years, here is one of the first times that I'm hearing about what the Bladder Cancer Advocacy Network is. And I think it's important to educate patients that you can actually educate your physicians about what's out there, about the newer treatments, about what's available on the network, not only to guide your physician,
Absolutely.
Medicine's moving so quickly now and the advances that we have, but also it's so helpful for other patients to know, and it's frustrating as a clinician to know that there is all this invaluable, up-to-date, evidence-based information with patients and advocates and experts who have put in a huge amount of time and effort to put the right resources together, but most importantly, it's getting that information out there to know that there are these networks, these organisations that you've talked about. So message to patients out there, don't be scared to speak up, fight for what you need, both in terms of education and support. Thank you to all of you for the fantastic work that you do for all of our patients and caregivers, and for spreading the message for education and awareness. Thank you so much.